Good afternoon, everyone, and welcome to our COVID-19 Town Hall meeting. I would like to turn over the meeting to our CEO, Mike Redman.
Welcome to today's Town Hall, the first day of July 1st. It's been a few weeks since we gathered for our Town Hall. We have a couple of updates for you before we get to your questions, but we appreciate you being here and listening in. June was a busy COVID month for the state of Hawaii. I'm sure you've all read the papers and seen TV. If you look at the news, there's been a lot of positive COVID cases in Hawaii, and they climbed last month. Last month in the state of Hawaii, in May they had 46 cases, in June 275. Fortunately for us on Maui, most of those cases have been on Oahu. But it's likely we'll see a steady increase on Maui when the island begins to reopen for mainland visitors on August 1st. I recently heard the Lieutenant Governor speaking about pre-testing process for visitors. If a visitor's coming here, they're going to have to be tested 3 to 5 days before they come. There's still a lot to be managed out in the testing process, and I'm sure it's going to be resolved. But we're going to be prepared. The state's doing everything they can to mitigate any risk by testing people before they come to our islands. But if there's a surge, we're going to be ready. And even though our town hall meetings and our EOC digests are on a less frequent schedule, I want to assure everyone we're working behind the scenes with the EOC to ensure our surge plan is ready, and we're prepared to have the proper protocols and processes in place to reduce any COVID exposure risk should we have to face that. We have a few guest speakers with us today. Christy from Employee Health is here again to give us an update on advanced practice provider services. I'm also happy to have Dr. Vijak from our emergency room to provide a COVID universal screening and testing update. Dr. Kimball Poon's here with us today. And Melinda from our foundation is here to provide an update on the Guardian Angel program. But before we get to our guest speakers, let's first check with our EOC team for an update. Dr. Shea returned from a few days away from a well-deserved break, and we're happy to have you back, Mike. Special thanks for Dr. Poon for his great work in filling in for Dr. Shea. And of course, Debbie's here to assist us with the EOC. So let's start off with an update with Debbie and Dr. Shea.
Good afternoon, everybody. I also want to welcome Dr. Shea back. We're glad to have you back and glad you had a good time off, staycation. And I personally want to thank Dr. Poon for covering for Dr. Shea and supporting the EOC, and it was my pleasure to work with him. The EOC continues to meet even though we do not have any PUIs or positive patients in the hospital. What we're reviewing during our meetings are the visitor protocols. We're ensuring that we continue to be safe as we increase our elective procedures. Surgical procedures are now at 100%, HPVs are at 100%, so we're moving those along, but we want to continue to have these meetings so that we make sure the patients, employees, the providers, everybody is safe. And then we're also ensuring that we are prepared if and when there is another surge, so we continue to work on those plans and review what we've done in the past. And then we're responding to the EOC email. You can see on the screen the statistics for Maui, and you can see that our Maui County went up to 125. Those were 2 additional Maui County positive patients that were reported as of noon today. And then the last 24 hours in the county, there have been 2 positive patients. We have no positive patients in the house, no positive patients admitted in the last 24 hours. Thankfully, we remain at our 5 COVID deaths. And if we have no patients in the hospital, then we don't have any patients on the bench, right? So that makes sense. And then the next, you can see on the screen the next group of providers and staff that have been tested negative and recovered, that hasn't changed. And then at the bottom, the last positive patient admission's been 61 days. The last COVID patient on event, 74 days, and the last day since MHS positive COVID death has been 60. So those numbers all remain great, and we hope to continue those even with a little bit of surge we're seeing in the county. Thank you.
Thank you, Debbie. Dr. Shea?
Thanks, Mike. Aloha, everybody. Very glad to be back. I had a really, really wonderful 10 days of staycation on Maui. And I wanted to share some thoughts that I had while enjoying our wonderful home here. We have a unique opportunity as things begin to open up here on Maui, and yet the mainland tourists are not coming. We have the chance to enjoy the things usually that are inundated with tourists. And so we can go to all the places we love to go, and we don't have to wait in line, and we can really enjoy this beautiful place that we live. Remember, keep wearing your mask, keep washing your hands, try to maintain appropriate distancing between people. But the beaches are empty. There's plenty of room for everybody. I took a dip in Ia Valley on Monday. It's just, we live in such a great place, Maui no Kauai. So be safe, but get out there and enjoy the island before the tourists come back. Thanks.
Thank you, Michael. Well, no town hall is complete without an update on PPE from Joyce. So Joyce, can you give us a quick update?
Sure. The following chart represents the days on hand for PPE supplies as of this morning. Based on our current usage, we are reflecting greater than 60 days on hand for almost all categories except for 3. The days on hand also includes usage by our procedural areas that have also increased their volumes this past month. While we are reflecting 262 days on hand for our N95 masks, there are constraints on medical or surgical N95s due to the availability of supply and the recent COVID spike in cases. KP has just received a significant quantity of NIOSH certified or industrial N95 masks. If you remember, we talked about this back in May at one of our town halls. And they've also brought in more face shields, as they will be needing to deploy these types of N95 masks and face shields to support any shortage of surgical N95s. That's it.
Thanks, Joyce. Well, Chrissy is back. She's become a regular at our town halls. Thanks, Chrissy, for being here. She's going to provide us an update on our advanced practice providers that have been assisting employees throughout the COVID screening process. Chris, thanks for being here today. Can you give us an update?
Thank you for having me back. So the update is that we're going to continue to have the advanced practice provider. We do have some new hours of operation, and just a reminder that this provider is available at the MMMC Emergency Department. They're there to provide a medical assessment, return to work guidance, and instructions, and these are for employees that are experiencing symptoms consistent with COVID-19. So the new hours of operations effective today is Monday through Friday, 8 a.m. to 5 p.m. And basically what that means is we have that dedicated APP there, Monday through Friday, 8 to 5, but the same services are still available after hours. And also note that employees that work at the Kula or the Lanai locations, they also have the option to see the provider available in the emergency department. Instructions for employees: if you are having symptoms consistent with COVID-19, do not report to work. Follow your departmental process for calling out sick. Keep your manager informed while you're out sick. You're responsible for updating your manager when you will be missing work. And then if you come to the MMMC location, make sure to pick up the form at the PCA screening entrance, fill that out, and register with the emergency department. If you are at the Kula and Lanai location, all you need to do is just check into the ED, let them know that you're an employee. If you are being screened for COVID-19, make sure you also keep our department informed. You can email us, and you can see our email up there on the screen. And if you're under the care of your healthcare provider, upload your medical clearance along with your COVID results to your My Health portal, which can be found at www.kp.org/employee health. And if you don't have a My Health portal because you're contracted, you can just email us. Our return to work guidance is still the same, but we're going to go ahead and review that. If you are out with symptoms consistent with COVID-19, If your test result is negative for COVID, you can come back to work after you've had 3 days of recovery. And recovery means like if you had a fever, you cannot have a fever without taking fever-reducing medication and improvement of your symptoms, along with your clearance by if you see the APP or if you're going to be seeing your healthcare provider. If you do happen to test positive for COVID-19, you need to stay out of work for at least 10 days since the onset of your symptoms, in addition to having those 3 days of recovery. And again, we need you to also be cleared by either our EHAPP or your healthcare provider. And if you do have questions, feel free to reach out to us. Again, our email is mhs-employee-health@kp.org, and that is the update I have on the advanced practice provider.
Thanks a lot, Chrissy. Appreciate it. We also have a number of questions around travel guidance for employees. I'll ask Chrissy to address those in our questions and answers at the end of the session. As we mentioned last week, our universal COVID screening and testing began for all emergency department admissions, direct admissions, and also for our OB patient admissions. We did this for a number of reasons, mainly to protect all of you and our patients from risk of COVID exposure, but by identifying patients that are positive as early as possible. We've invited Dr. Vijak here today to provide an update on the universal screening and testing that is done in the emergency room. Vijak, thanks for joining us today.
Thank you, Mike. Glad to be back. As Mike was just alluding to, we did start a universal screening and testing protocol early June. As all of you know, we're trying to do our best to keep everyone here safe. And with the rising cases in the mainland, we definitely need to keep a good surveillance. Right now, we have universal testing so that everyone who's coming in through the emergency department who's going to be admitted, including direct admissions and OB patients, are being tested. That way, we've been able to ensure you that every single person since the beginning of June, since we've started this program, who has been admitted to the hospital has not had coronavirus. So that's very important for everyone to know. It increases the safety for all of us, all of our patients, and all of our employees. Now, we're going to keep a close eye on our community. And with the continuation of the universal screening protocol, it acts as a great surveillance tool for us as well. Everyone who's going to come into the emergency department, who's going to be seen for any symptoms, we're testing them, obviously, especially if they're going to be sick enough to be admitted. And that way we can have a good idea if it's returning to our island. Now, rapid testing has always come up, and I want to point out that there is a difference between universal and rapid testing. Universal testing really does mean we're testing everybody, but rapid testing is just about the speed of the test. Right now, our testing capability has our tests returning within 3 hours, and that's pretty fast, as opposed to when we first started, which was several days, and now we can do it in-house, and we're going to have increasing capacity, expanding by the end of July very shortly. We're going to just have to accept this is going to be a new normal. We're very supportive of Mayor Victorino and all of his efforts, along with our government, to slow the reopening of Maui to visitors and businesses so that we can do it safely. With this, it's vital not to lose our perspective in this pandemic. It's here to stay, so we have to be prepared. I'm going to echo what Mike said earlier. You got to wear your mask. 4th of July is coming. We all want to hang out and be with our families. Although we say practice social distancing, I just want to emphasize it's more physical distancing. We should always socialize. We have family. We have ohana. We want to be with them. It's not about avoiding your friends and family. It's about just being safe. Wash your hands. Wear a mask, try not to stay too close for too long, create these bubbles that they keep on talking about, whatever it takes to try to prevent the spread of any type of asymptomatic or should I say pre-symptomatic spread, and help us spread the word. Don't delay care. Last couple of days in the emergency department, we've had increasing numbers, and I'm happy to say that I've been able to see and take care of a lot of people earlier, including heart attacks and broken bones. So don't be afraid. It's important that we spread the word, because what we say to our friends and families goes a lot farther than anything else. I'm grateful to everyone here for helping us to flatten the curve on Maui, and hopefully we can keep this up as we reopen businesses and reopen our economy. But we got to do it safely, because I do not want to see a spike. None of us do. So thank you very much.
Thank you very much, Vijak. Dr. Vijak has become quite a Maui Health spokesperson in the last few months. He did a great op-ed piece in the Maui News, a radio interview last week, and he was a guest speaker at the mayor's press conference. We're grateful for your willingness to share what's happening inside our walls and how we're prepared to take care of our community when emergency care is needed. We appreciate your time today and the outstanding care you, your colleagues, and our staff provide us and our community.
Thank you, Mike.
Now let's welcome Melinda from our foundation to discuss the Guardian Angel program. Melinda?
All right, good afternoon. Thank you, Mike. We normally would have had our Guardian Angel event in June to celebrate the amazing staff and physicians that have been recognized by grateful patients through donations made in their honor. However, this year, the foundation and administration felt that every staff member needs to be recognized for their amazing courage, hard work, and compassion these past several months. In partnership with Goodfellow Brothers, we put together a mailer that was mailed to 15,000 households in our community, celebrating all of you. Some of you may have already seen it. During the week of July 13th, the foundation and leadership will be coming to your department to personally thank you for your hard work and dedication of taking care of our community. We will be giving each employee a copy of the Guardian Angel mailer and a small gift from the foundation. And in partnership with communications and marketing, we will publish external and internal communication all week long celebrating all of you. Mahalo for your passion and commitment to our community. Thank you.
Thank you, Melinda. This year's foundation report is really an outstanding publication. If you haven't seen it yet, you will see it soon. I can't thank the foundation enough for all they've done for us. Not only what they've done during the COVID-19, but each year for us. So they have really made a difference in our programs and our ability to reach out and care for our community. And now they're looking at really sharing with us that we're all guardian angels. And I can't question that. Everyone has done a great job. So thank you, Melinda.
Yeah, thank
Now
you.
let's get to your questions. Risha, would you start our questions for us?
Absolutely, Mike. What are the current warm units?
Debbie, you want to answer that one?
Certainly. So as I mentioned, and I'm the EOC update, we currently don't have any PUIs or a positive patient in the house. So we technically don't have a warm unit. However, as we've talked before, the Waialuku Towers remains with its barriers and set up to be the COVID unit. And should we have PUIs or positive patients, they will be admitted there. That's all set up, everything's in place, and it'll just take an hour or so to get nursing and staffing in there to be able to accept the patient.
Thanks, Debbie.
Hilo Medical Center recently announced that they were able to test all 1,500 staff within a 4-day period. All results were negative. Will Maui Health be testing all employees for COVID-19, thus this being true to universal testing, not just for universal testing for patients?
I think we answered a question similar to this in the past, but I'll ask Dr. Shea to answer for us.
Sure. Thanks, Mike. So I think, first off, I'd like to remind everybody that through targeted testing, we have tested the gross majority of everybody who works here. So most of you have already been tested. I think the two things that drive this testing question are the science and the emotion. And I think the science is pretty clear that doing routine testing of healthcare workers when we have a low incidence of COVID doesn't make sense. We've talked with Kelly in infection control and Dr. Hoskinson, our ID doctor, as well as ID physicians on Oahu and the State Department of Health experts. And at this time, they agree. I think it's also important to understand that the one thing that's constant about our world with COVID is that it's constantly changing. So this may change in the future. I think it's important for us not to react on emotion, that the value of a negative test right now really isn't that high. I think most all of us have been tested, we're negative. We haven't been exposed because there isn't a lot of COVID. If you've been traveling abroad, perhaps getting a test on your own might be a reasonable thing to do. But for right now, with the current low incidence of COVID in our community, it doesn't make sense to do broad testing of all of our employees.
Thank you. It is amazing. We haven't had a positive COVID admission for 60 days now in the hospital. But that's why EOC continues to monitor this. Next question.
With more employees making plans to travel outside of the state, would it be feasible to have these people swabbed at our facility prior to returning to work in addition to the self-monitoring? The recent surge around the U.S. and world concerns me for people potentially returning to work asymptomatically.
Chrissy, you want to help us with that one?
Absolutely. So we are currently reviewing our interim travel guidance, and we will be making changes that align with the state of Hawaii requirements for trans-Pacific travel, and we know these are to begin August 1st. We do realize that COVID-19 cases continue to increase in other areas. Therefore, prior to travel, I think we all need to make a clear plan, review travel health notices on the CDC website, continue to keep our guard up against COVID. And I agree, I think as in a community, as a hospital, we've done an excellent job in responding to COVID, and we just need to continue to maintain that. We know that the health department is still in the process of developing this program in the coming weeks. So as we receive more information, we will be adopting these revisions. So please stay tuned for that update that we're going to have.
It's very likely from what we're hearing that anyone returning to the island, including our workers, will have to be tested. And if they test negative, they can come to work. If they test positive, they're going to have to quarantine themselves. So the state is being very diligent and trying to set up some new guidelines to protect us all. Thank you. Next question.
Do we have enough tests to accommodate the reopening of the state to mainland visitors on August 1st?
I'll take a stab at that one. Yes, we do in the hospital. We'll have enough test kits and test materials to test all of our patients admitted, test anyone who's symptomatic, test anyone that the emergency room needs to test. We don't have enough test kits for the entire island. We're not a testing site. All of the urgent care centers, many of the practices does testing, but when the visitors come back, there's just not enough testing kits and testing material in the state of Hawaii to test every single visitor if they're asymptomatic. The state is trying to increase their number of tests that they can do. Right now, the state as a whole could do up to 5,000 tests a day. They're trying to move it up to 10,000, but they're not there yet. But I am confident we have what we need here in the hospital to take care of our employees and take care of the patients that we take care of.
Our next question, what is the current policy for employees who travel outside of Hawaii, and will that change as of August 1st?
I think we touched on that, but Chrissy?
We did touch a little bit on it, but our current interim travel guidance is to notify your manager, notify employee health of your travel plans, request for an essential worker exemption through the state of Hawaii to allow you to come to work after travel. Additionally, you need to self-monitor for 14 days from the last day of your arrival to Hawaii, and any employees after their travel that develop symptoms consistent with COVID, their default to continue that departmental process of calling out sick, seek medical guidance, and as I previously mentioned before, we are reviewing our internal travel guidance and making revisions to align with the state of Hawaii, and we will be keeping everyone up to date once revised.
Thank you.
Our next question, will hotels be sending their sick guests to the ER for testing?
Well, I don't think the hotel will be directing them to any one location. If someone's sick, they will probably be given a list of the urgent care centers, physicians that will see them, and our emergency rooms as well. It's up to the patients to go wherever they feel most comfortable to treat their symptoms. And keep in mind that some of the symptoms are not COVID related, but they will be directed to get tested or have their symptoms evaluated by a medical professional.
Our next question, how accurate are the rapid tests versus the standard tests?
Dr. Poon, could you help us with that?
Definitely. So let me try to clarify some terms. Here on Maui, the difference between rapid and standard really isn't a reflection of the test, but of how we handle the sample. When we use the word rapid, it means we're testing it, as Dr. Vijak was saying, in-house using this Luminex machine, and the results take about 2 to 3 hours. When we use the word standard, it means we're putting that sample on a plane to Oahu, so it takes about a day for the results. And the platform that they're using on Oahu is called the Panther, and that gives the results in about 3 to 4 hours. Both the Luminex and the Panther are excellent machines and are very accurate. And as Dr. Vijak said, we'll be getting a Panther at the end of July, should be working by then. Now, the question about the rapid testing is the following. You may have heard some bad news about this particular rapid test called the Abbott ID Now. So when this machine first got released, it really boasted some impressive turnaround times of 5 to 15 minutes. I mean, I was kind of floored because as Vijak was saying, it'll take a couple of days here. But then it got plagued by these terrible reports. NYU reported it was missing about 30 to 50% of infections. So that rapid test does not have good test characteristics, and we're not using it here on Maui.
Thank you very much.
Do we have any plans to coordinate with hotels on testing, education, or to provide any other resources?
We're trying to do that. We met with the mayor just last week and with his staff. We would like very much to be part of the solution to keep people healthy on Maui. We've suggested that there be some standardization on how the hotels deal with patients that may be sick, I should say visitors that may be sick, as well as we're offering to help educate the staff on cleaning techniques and how to wear PPE and do safe distancing. We haven't done that yet. We're working with the mayor and his staff. They're reaching out to the hotel industry. In the month of July, we hope we can make a difference and partner with the county to keep our visitors safe, and equally important, if not more important, our healthcare workers who need care for everyone on Maui. Next question.
Are there different types of swab tests?
Dr. Poon?
Sure. So swab testing refers to where we're collecting the sample from the patient. So the two most common are the nasopharyngeal and the oropharyngeal, which I'll go after. But you can also do the lavage that Dr. Shea and the intensivists do. You can also do saliva. These are all things that are not commonly used now. But the two main ones are the nasopharyngeal and the oropharyngeal. So the nasopharyngeal is the one on the left. It's not really comfortable, as you can see by the person's hand. They're going to hub that orange part all the way down to your nostril. So it can be a little uncomfortable. The oropharyngeal is the one where you just open your mouth and the swab tickles the back of your throat. The real question becomes, why would anyone, go through the one on the left? So it depends on the machine. Each machine sent applications to the FDA to get this emergency authorization. And so some machines only applied using the nasopharyngeal and some use the nasal and the oropharyngeal. So the Luminex, the one we have downstairs, is using the nasopharyngeal only. The Panther that's coming hopefully in July uses both the nasal or the oropharyngeal.
Great explanation. Thank you very much. Appreciate that.
Are we concerned that rapid tests are not reliable?
We kind of touched on that. Anything you want to add, Dr. Poon?
Nope. Just again, this Abbott ID test that everyone was super psyched about when they first reported these short turnaround times turned out to be a bit of a bust. There is one on Maui, but it's not in operation. We're not using it.
Thank you.
Our next question, are we still asking the community for PPE donations?
Melinda, help us with this one.
All right. We are continuing to accept PPE, handmade masks, and head coverings. However, we are not currently promoting it in the community at this time. If you have someone who has inquired about donating, we would love to accept the donation. So please direct inquiries to Cassie Chavez. Her extension is 2632, or her phone number 242-2632. Again, that's 242-2632.
Thank you, Melinda.
Our next question, can we still request funds from the foundation to purchase equipment or other items to provide service or fulfill patient care or staff needs in our department?
Absolutely.
Melinda?
Yes, absolutely. You can request funds from the foundation. We have a current fund request process that was established in 2018, and for more information, please contact Tiana Cordero at 242-2630, and she will give you the form and talk to you a little bit more on how to process the request. And again, her number is 242-2630.
Thank you, Melinda. Well, I want to thank you, everybody, for their questions. We have a couple left over, which we'll do at the next town hall. We're running out of time. I hope you enjoyed the town hall today. Reminder, the EOC Digest will be distributed tomorrow in combination with our employee newsletter. They'll still be emailed to you, but we'll hand them out as well, as we've been doing with the Digest. Please know that information needs to be shared before our next town hall. Let us know and we'll get it out sooner. We, again, thank you for joining us and your continued support. Have a safe 4th of July, but do us a favor. Observe social distancing. Keep your mask on. Keep your hands washed. Have fun, but be responsible. This is what we all worry about, is social gatherings. We ought to get out there and have fun with everyone, but just be careful. Thank you so much. I look forward to talking to everybody on July 15th. Have a great day.
Thanks, Mike. This concludes our employee town hall meeting for today. Thank you for joining us. We appreciate all that you do here at Maui Health. Have a great afternoon.